This program is implemented in Southern Africa, covering 6 countries, including the Republic of South Africa, Eswatini, Lesotho, Zambia, Malawi, and Mozambique. Through the training of over 1,000 change agents who are positioned at the local level, we've been able to reach more than 300,000 people. The program largely focuses on improving access to sexual and reproductive health and rights and HIV services.
We have specifically targeted 3 types of beneficiaries: migrants, sex workers, adolescents, and young people, and taking them from a position of vulnerability and empowering them with education to be able to claim their rights without fear of being discriminated against.
We apply a number of approaches to ensure that access and use of services is achieved. Among them is the involvement of the migrants, the young people and sex workers as change agents. And by change agents, I mean peer educators that are selected within the beneficiary populations to effect social changes within themselves. The reason we emphasize this is that for many years, the migrants themselves have not been involved in these programs. They have been marginalized. And being a hard-to-reach population, it becomes extremely important that we bring them on board.
Change agents are respected community members. They are trusted community members that are actually identified by the communities to come into the project to be trained as change agents. And the type of training that we offer ranges from education around HIV, education about reproductive health, education about growing up, education about puberty, education about human rights.
The change agents who are selected within the communities are linked to the existing health service provider, and change agents mainly do the referrals. They identify people who are at risk of HIV and SRH problems within their communities, refer them to the facilities, and ensure that they receive the services for which they have been referred. We've witnessed that sex workers who've been capacitated are able to reach out to more of their fellow sex workers, but also those sex workers are able to reach out to their clients and even beyond, including the communities within which they stay. Some of the sex workers, through the capacitation in entrepreneurship skills, are able to take on alternative livelihood activities, setting up small businesses, but also being linked to existing microfinance services. Most of the communities where we operate are largely traditional communities that are bound by social and cultural traditions, which shape their way of life and their way of behavior. In some of these communities, you will witness traditional practices that perpetuate sexual and gender-based violence. Those that have been able to capacitate have made significant improvements in terms of challenging these traditional harmful practices. Our engagement with these traditional and religious leaders, their participation is very critical.
Above all, we have to demonstrate that we are making changes. We also train our change agents in monitoring and evaluation. We train our program officers in monitoring and evaluation and in data collection, data management, data storage, and data for reporting.
One of the successes is the adoption of the recommendations that came right from the grassroots dialogue processes being endorsed by the ministers of the SADC. And all these recommendations aim to ensure that migration issues are prioritized within country policies and plans, but also that these issues are part of the wider framework around discussions on having a regional migration policy for the Southern Africa region that is aligned with the African Union migration policy.
We are using the rights-based approach. This is to emphasize that amongst the beneficiaries that we have chosen for the project, they have the right to access health services without being discriminated against, either for who they are or what they have to bring.
Migrants are human beings, sex workers are human beings, and therefore they should be treated the same way other members of the host communities.
We are working in 6 countries. SADC is 16 countries. HIV prevalence, it's still at unacceptable levels. The capacity to provide antiretroviral treatment is still seriously constrained. Going into the future, we need to look at including other countries.
While the project has been able to reach over 300,000 migrants, sex workers, and young people within the migration-affected spaces in Southern Africa, we still have over 3 million migrants to reach.